Welcome, everybody. Thank you for coming. I see there's still people streaming in outside, but because we have some folks outside the Cambridge area joining online that we said we were going to start at 5:15, we'll do our best to do that. Hi, my name is Christine Heenan. I'm an executive partner here at Flagship Pioneering and the Chief Communications Officer. And welcome to our celebration of International Day of Women and Girls in Science. This is pretty amazing. We are thrilled to have you here. There are more than 300 people who have signed up to join us in person today. That is history making. There have never been 300 people, women, from the Flagship ecosystem in one place ever. So congratulations. You know what? I want to take like one of those Ellen DeGeneres selfies. Well, right. So everyone just stand up for a second, and I'm going to turn around and take a picture. All right. All right, ready? On three. 1, 2, 3. Woo! All right. Coming soon to a Twitter feed near you. So, International Day of Women and Girls in Science was started by the UN in 2015. It is technically this Saturday, February 11th, and it is meant to, quote, promote the full and equal access of participation of women in science, technology, engineering, and mathematics. Almost any woman in science can tell you we are not there yet, so the UN and all of us have more work to do. According to the NSF, women make up only about a third of people currently employed in STEM fields. However, the number of science and engineering graduates earned by women between 2011 and 2020 increased at every level, from associate's degrees to doctorate degrees. I am thinking about those newly minted PhDs and where they will deploy their talents, in part based on who recruits them, in part based on what sectors and what companies value their contributions, and in part where they can be mentored by people who look like them and understand their experience. To me, we have a huge opportunity at Flagship to be the employer of choice, or the employers of choice, of that incredibly talented pool, and we're all, I think, part of that. And today we have an incredible set of conversations and speakers that will just remind us all of the remarkable talent in our ecosystem. So our featured speaker tonight is Sigal Kadosh. She's a great example of a leader whose impact has transcended organizations and sectors. She completed her PhD at Stanford, after which she established her independent lab in 2014 at the age of 28 as one of the youngest scientists ever appointed to the Harvard Medical School faculty. She's an academic leader and an entrepreneur. I think it's always helpful to realize that it's not an either-or equation, and Sigal proves that. She holds appointments at the Dana-Farber Cancer Institute, the Broad, and HHMI. She's a leading expert in chromatin and gene regulation and internationally recognized for her groundbreaking studies in these areas. She's the scientific founder of Flagship-founded Foghorn Therapeutics, pioneering a new class of medicines that treat serious disease by correcting abnormal gene expression. I know we have several members of the Foghorn team here tonight, so go Foghorn. Sigal has numerous accolades and awards for her work, including the NIH Director's New Innovator Award, the American Association for Cancer Research Outstanding Achievement in Basic Cancer Research, and was recognized by the Forbes 30 Under 30, MIT Review's 35 Under 35, and Biotech Insider's Top 30 Young Leaders in Biopharma. So if I read all of Sigal's accomplishments, any of you here hoping for that 30 Under 30 designation would be more than 30 by the time we left. So I'm going to stop it there. Suffice it to say, incredibly accomplished. I'm thrilled you're here with us. Sigal, thank you for making the time. Please join me on stage. All right, little walk-on music for you there.
Thank you so much.
As you can see in the audience, a lot of those who are joining us today are at the earlier stages of their career. So take us back to the early stages of your career, your early research, and what sort of defined the direction you went down.
Yeah, so first of all, thank you so much for having me. It's really a great pleasure to be here. I'm delighted to participate in this event, especially in person back this year, so this is extremely exciting and a big honor. I want to take you a little bit, all the way back, actually, to really a monumentous moment in time, I think, which was the sequencing of the human genome. And once we had the ability to do that and sequence the human genome, we were able to sequence disease genomes. And at that moment in time, this essentially set all basic researchers like myself back at ground zero, because for the first time, we understood the true genetic underpinnings of human disease. And this was a very exciting time, opened up many new fields, including the field that ultimately gave rise to my lab, into Foghorn Therapeutics, where we learned that there were these elusive machines that actually play critical roles in driving cancer. And these machines, in essence, sit along our genome and govern the accessibility of our over 2 meters of DNA that fit in the nucleus of every single one of our cells. So it was quite remarkable, but the problem was that there was a number of new questions to ask about these machines, which we knew if we could answer those could potentially be coupled with therapeutics. But we had a long way to get there. And so at the moment that I was a PhD student, we looked, try to take a unique lens to understand these complex molecular regulators by actually looking at rare disease. And it was rare disease that sort of founded the basis of my early career. And I tell you this—
Pause us there. Did you make that decision on your own? Did you make that decision based on research? Did you talk to advisors, peers, others? What allowed for that narrowing in decision making?
I always say, when we think about the science, you follow your nose to find patterns. You follow your nose to find causative features, when possible, of disease. So we had identified a member of this system called the chromatin regulatory system, which is what Foghorn focuses on, what our lab focuses on, and found that it was uniquely tied to 100% of cases of a very rare cancer called synovial sarcoma. And as part of this rare cancer story, I just want to say that even as I moved across the country later to start my young lab, I had a lot of pushback about why am I going to study a rare cancer? Sigal, you now have this opportunity to sit at Harvard and the Broad and run this huge lab. Why are you going to only study a rare cancer? We weren't only going to study that rare cancer, it turned out. Of course, I would be happy if we were able to succeed in ultimately curing or ameliorating this disease. But we use this as a platform upon which to study what is now a tremendously large area of biology, accounting for perhaps over 50% of human cancers and a number of other disease contexts, from immune conditions, cardiac conditions, neurodevelopmental conditions, and so on. And so I think that confidence to try to focus on this area, learn as much as we could from a rare indication that was truly telling, I think, of this biology, and then ask ourselves the question, how can we take those patterns, those learnings, and apply that across a much wider range of diseases? That's essentially one of the formative aspects, I think, of my young career, and I think a learning that I still take as I think about the next set of questions, and certainly as I mentor the next generation, thinking about try to find those patterns, because biology tends to take mechanisms and use them in multiple different spots. So if you find a mechanism, it turns out is most likely not a one-off mechanism. You may have many places, many disease types, many aspects of the cell that might use a very similar concept. So don't be afraid to go pattern hunting and try to find those concepts.
But you talked about courage to do that pattern hunting, but you also, in your story, demonstrated courage in the face of advice contrary to your instincts. Why would you study just that? Why? Talk about that, because probably those were some people who were more established in their career, or what led you to have the confidence to say, I take your feedback, I take your input, I have an instinct here and I'm going to follow it?
Yeah, even at the tail end of my PhD, this was sort of a PhD project. I had joined a lab as a PhD student that I was fiercely wedded to studying cancer, but I joined a lab that didn't study cancer. And I did that, it was, again, counterintuitive, perhaps the path less traveled by. I did that because the biology just spoke to me, telling me that, I think a study of development, which is, cancer is often development biology gone wrong, would perhaps lead us in the right direction for new directions that hadn't yet been explored. And that ended up being the case. But sometimes this path less traveled by, though I didn't have more than just a sheer instinct, I think was an interesting path. And I think another time that this, happened was as I started my young lab here in Boston. There were, at the same time, we now had learned that these molecular regulators in the nuclei of our cells were perturbed in over 20% of cancers. It was becoming obvious to the drug discovery industry that this was going to be a major set of new targets. It became obvious to big pharma, but there was, again, a fundamental gap in knowledge, which, of course, we've worked over the past several years, almost decade now, to try to fill. These were totally new targets, previously elusive, unknown functions. And with that came opportunities, of course, to have the lab directly just partner with large pharma. And in fact, I was again advised to do that. As you can see, I didn't do that. I ended up starting Foghorn with my partner Doug Cole here at Flagship Pioneering to do this. And but at the moment, this was the advice given to me was, yes, just have one of these larger companies support a big part of your lab, and that will be what we do. And that was the kind of the general model at the time. And I was, again, just something told me that a combination of what we were going to learn from in a rare disease, plus the sheer biologic challenges, was going to need a dedicated group of people, a dedicated entity to focus exquisitely on this biology to make new inroads in directing this toward therapeutics.
You've given us a new twist on the road not traveled. It's the advice not taken.
Yeah.
Give us a piece of advice you did take early in your career that's been a difference maker.
I think one of those is to have, so there's this concept of mentorship. And even as we start faculty positions or as we start positions in companies, of course, everybody encourages one to find a mentor. I think this concept of a mentor is really plural. Mentors is what's really needed. And I think that for me, one of the kind of transformational moments in my young career was realizing that even as you start a faculty position at Harvard, it says your faculty mentor as your junior faculty sort of sign-off sheet. But really, a number of mentors contributed to my thinking along the way. And that includes a really diverse group of people, from mentors in the pharmaceutical side, in the academic side, in the entrepreneurial side. One of the best times of my life, I always say, was in the very beginning stages of starting Foghorn. Doug, there was a period of time where Doug and the rest of the Flagship team encouraged me to meet investors, and I was having a breakfast at 7 a.m. almost every single day before running to the lab to run the lab. And during that time, I gained such a diverse perspective on just this entire ecosystem and what it's all about. Mm-hmm. And I also taught myself that, I was in the beginning perhaps concerned that I didn't have, training in business. I only had training in biochemistry, really. And I mean, even though I went to Stanford, and that's of course known to be a very entrepreneurial place, and I'm now coined an entrepreneur, I really didn't have any entrepreneurial experience and even exploring what a startup would look like. Mm-hmm. There was none of that. It wasn't that I came in with this idea to do this. It was really just following one's nose on the biology. And I've learned in that experience that the more we do that, the more we are likely to overturn key rocks that each of which I think can be accompanied with exciting therapeutic opportunities.
You've talked about mentors. I want to ask about networks, because as you had those 7 a.m. breakfasts, right, you expanded your network. As you built out your lab, you expanded your network. As you taught, as you went into company building. How important, what would your advice be to women in an earlier stage of both scientific exploration and entrepreneurship in terms of the importance of networks to get where they want to go?
Yeah, I think, again, the diversity of networks is really key and has certainly played a pivotal role in my career. I think, environments like this evening tonight, take every single opportunity to meet the incredible women and everybody in this room around you. I think, we're all here for a reason. We're fiercely dedicated to pushing the boundaries of biomedicine forward. And, being surrounded in this kind of a community with so many like-minded individuals is very special. It doesn't occur everywhere. We always it's easy to take this for granted because here we all are living in this environment, but it's really quite special. So in situations like this, it's certainly very important to try to use these opportunities to network as much as possible. I had probably an exponential number of new people I met during the time of founding and developing Foghorn. At the same time, I had, which was kind of, coupled with my developing of the lab. On the academic side, meeting more leaders in their fields across different fields. And here too, companies are doing vastly different things. But again, trying to understand the basis of what success stories, led to those successes, I think is really key. And it's been so much fun to be in this kind of ecosystem where you see such diverse thinking, such creative thinking. Again, finding a pattern and asking, can we apply it in a totally different way? And there are so many examples of companies like that from Flagship. So.
A lot of people who come through the fellowship at Flagship are struggling with a decision between an academic path or a pure academic path and an entrepreneurial company building or company contributing path. You've really straddled those worlds successfully. What does one not understand about the other, or where are the dichotomies false in terms of publication strategy or ability to focus on pure research? Or walk us through what you've learned from having sort of a dual passport.
Yeah, I think this is I do kind of live this dual existence, and we have a number of these discussions daily in the lab about people with this exact same conundrum. What do I do next? I've had a lot of fun in the lab. I love experiments. I love making discoveries, but I also really want to play a key role in driving these forward into new medicines. And that was my shared goal. And I think that's why I ultimately just sort of fell where I fell, which is sort of in between, as you said, straddle between these two worlds. I have to say I love my job. I love the ability to, go to work every day and uncover whatever we're going to uncover in the academic side of my life, and to be able to contribute to the pushing forward of that new knowledge into new thinking that can, yield, of course, new therapeutic opportunities. And to now, for the first time, see some of these actually going into people, which is a really exciting time for Foghorn. I think that there are a number of, in the earlier days when I was actually just starting the lab, call it back to 2014 or so, nowadays we have so many more, potential companies to join. There's so many more startups. There's so much more biotech. There's so much more energy in biotech. This whole, ecosystem is surging still. And, at the time that I started Foghorn, it was just not quite as much that way yet. And so I think, and certainly when I was a PhD student, if you were going to go into industry, it was almost always pharma. And now that whole, tide has changed. And there are a number of opportunities where one of the misconceptions, I would think, is that in startup companies or in early biotechs, now you are purely going to be doing drug discovery efforts, and there's no more discovery. So I think a lot of PhD students or postdocs coming out of my lab worry that they'll miss that key element. But actually, that's not true anymore. And I think flagship companies are a perfect example of the fact that discovery is driving everybody's here existence every day. It's not that it's only to try to carry forward products to market. Of course, we're trying to do that. But I think that here, what's unique here is that there's never a lost sight of the total vision, the total understanding of a biologic concept that's providing the platform for an entire company. And so I think that increasingly, that level of ability to assess scientific problems and push them forward in unique ways is able to be achieved both in the academic sector and in a startup community such as this one. And again, I say this one because this is a truly special community, and it's not the case everywhere.
Unlike many of us who join organizations that are sort of fully formed or joining Harvard at year 375 or something, you built a lab and you built a company. What attention have you paid to culture building, to inclusion, to the ability for ideas to come from anywhere? I'd love to hear your thoughts on culture and what you do to service a culture and nurture a culture at Foghorn and in your lab.
So I'll actually start with the lab. We actually just were having this discussion the other day. I think, of course, we interview and consider people for the lab all the time, both students, computational biologists, postdoctoral fellows, MD fellows. And I think one of the gifts that's kept on giving throughout the genesis of the lab has been diversity. Diversity in background, diversity in experiences, diversity in culture, and diversity in scientific thinking and expertise. That is something that we know already works from this community. We know is special about the Cambridge-Boston community in science and medicine. So why not make sure that that's also the case in one's lab? And it's easy to not do that because we all focus in a razor-sharp manner on one area of science or another. But I've taken a lot of effort to try to make sure the lab is diverse in the thinking and the skill sets and the people that we bring in. In one bay, for example, in our lab is a structural biologist, a chemist, and a MD fellow studying a very specific cancer type. And in the next bay is a biochemist, a biophysicist, and a computational biologist. And so I think you get these people talking, and it's amazing to see the creative new thoughts and new ideas that come from that. I've also learned a tremendous amount about culture and just scaling one's team, scaling the thinking, increasing the maturity of one's team by watching and participating in having Foghorn develop. I've learned a lot from, again, the co-founder of the company, Doug Cole, and the CEO of Foghorn, Adrian Gottschalk, and all the leaders at the company, and really watching these teams build, playing an active role in building them in the earlier stages myself, and then watching the company now blossom to a 180 or so person company has been really exciting.
What are the things you need to look for on the company side that are less important on the lab side or vice versa? Talk about a bit of it as you do that building in parallel.
Yeah, in academics, I think it's kind of notoriously a little less organized, and I still think that's the case. It's a little less organized than the companies sort of have to be. There's a much more clear pyramid and order I think, to companies. That's just the way that this system works. And it works well, and it needs to work that way. And there is a reporting structure. In academics, and certainly in our lab, we have a very flat, it's a totally opposite situation. We have a very flat hierarchy, myself included. We just really are all on the same playing field. I happen to run the lab, but really we're all just working together from different angles to try to put ideas together to push forward the field. So they operate differently, as you're alluding to here. But I think you can learn important aspects of how a company is run and apply those to the lab. And I have done that along the way, kind of thinking about mentorship structure, individual one-on-ones versus group meetings. I've taken, I think, a lot of the learnings from the company and just listening a little bit about the culture, of the company and applying that to how I think about the lab, especially as we've incorporated new ideas and new skill sets.
And tell us, Sigal, about a setback. Tell us about a setback in either context and how you managed through it.
Yeah, I think one of the earliest setbacks was actually one, that we experienced, but the whole field experienced. This is exactly what I was talking about in the beginning, that there was such a wave of excitement, now realizing for the first time what drove a huge number of human cancers and other diseases that were genetically defined. It's pretty powerful. Diseases that were driven uniformly by a problem in this one entity. It's a pretty good bet that that's going to be the causative entity that's driving that disease, but nothing known, or not enough known to be able to truly generate and build the drug discovery engine to go after that. The setback for the field was racing too fast. If you race too fast toward going after a set of targets, you may easily come up empty and realize that, okay, I can't do this and we're not going to be able to push forward. Our lab and ultimately what gave rise to Foghorn took a different approach, which was we knew we had gaps to fill in. We knew we almost needed to take several steps backwards, if you will, to understand this biology, to piece together the correct pieces in the order, and then be able to push forward in a much more exponential way. And I'm glad we invested that time. We didn't know how these, if you can envision inside the cell, these large molecular machines are multiple components pieced together that have to sit exquisitely on one specific part of the genome or another at hundreds of thousands of sites to properly coordinate genes turning on and off. And one subtle defect in how these machines run along our DNA or chromatin can give rise to disease. And they're extremely heterogeneous. There are many different types. We have a lot to understand and to unpack there. And it was tempting many times to feel a setback and to think that might be the final setback, that we won't be able to push forward. But coming at the problem, and again, from many different angles, using different scientific skill sets, was the ticket that ultimately helped uncover the biology that gave rise to new thinking and now successful drug design and drug discovery.
Rerouting.
Yeah.
Rerouting your GPS.
Yeah.
Tell us, I'm just curious because you did get your PhD at Stanford, and Newbar gave a speech recently about the Massachusetts miracle and the idea that sort of Massachusetts was first in the digital revolution. It completely changed the face of Massachusetts, the economy, the tax structure. And then we sort of lost that to California. And then the biotech wave, we sort of established and won. Life Science Initiative under Governor Patrick, sort of the presence of the hospitals. Now, as AI and computation becomes so much more key to the future of biotech, of biology, of biological discovery, Silicon Valley could claim re-relevance, new relevance. You've worked in both cultures. They're described very differently. What's been your experience in thinking about the sort of Silicon Valley, Stanford culture versus the Harvard Medical School, MGH, Cambridge structure?
So first of all, I'm incredibly excited about the power of AI, and it shows you how impactful this is when even trained biochemists like myself are using it now on a day-to-day basis to perform deep learning, machine learning based experiments across our data sets. I think one of the key features that sets this community apart in being able to now traverse this next 5 years, let's just say, in AI and machine learning-based approaches is the fundamental concepts of biology. Because supervised learning is what matters is what's gone into these algorithms, and what matters is what's gone in, how data is organized, what data is used. And I think, again, it's very challenging to think about those studies or experiments or efforts or companies without having an extremely firm hold on the biology and the data that's going in. It's less able to be, I think, achieved with the same meaningful output if we just have the sort of tech industry take that forward. So I think this is a very unique moment in time for AI in this community. I think it holds immense promise for understanding all the biology that we care about, and certainly taking forward the medicine that we care about. As an example used every day for us, AlphaFold and DeepMind is something that has completely revolutionized the work that we do.
ChatGPT did not write these questions. We wrote these questions.
But it has totally revamped our thinking of this biology. But there's so much more. If that's just the tip of the iceberg, in my opinion, there's so much more to be done. And as a community, what's key is asking the right questions of the data, asking the right questions of the computational capabilities, because it's the questions and the input, I think, that's really going to guide us into the future here. And that's where we do have a really powerful group of opportunities.
And that, to me, that's a sector capability answer and a company-led answer, a science-led answer. Do you experience a cultural advantage here? Is there something about Boston, Cambridge, and it's the deeper knowledge of biology, the hospital system, that will remain an advantage, do you think? Or does the sort of company-building culture, the sort of VC culture of Silicon Valley outweigh that? How do you think about that?
I think, of course, during the COVID time, everybody could get together just as easily on Zoom. So I think that, in part, you could argue that that's changed it. And so then why is this ecosystem, so special? But the hard wiring hasn't gone anywhere. And I think the hard wiring has a lasting impact that we still are observing today with just who's here today. Yeah. There's a reason why you're here today, and you're not just, only on Zoom, events like this. There's a reason. It's because you want to see people, and we want to interact. And I think when you get this community is so eager to do that, that I think it sets it apart. And it will set it apart in just the sheer probability of the opportunities that people come together with these ideas. I think with that said, it's not impossible, of course, that we'll gain significant technology and ideas and bring people from the Silicon Valley community more into biology. And I think that's another, responsibility we have as dedicated, people who are firmly dedicated and committed to, driving forward the next wave of biomedicine and biomedical technology. We should have it as a mission to bring more people in from outside this area, to bring their diverse collection of thinking and skill sets into medicine and into what we're doing. There's a pressing need to bring AI and other disciplines outside of this into what we do. And so that can be a mission, I think, for all of us in this ecosystem to drive that forward.
There's a great book that was published, I think, in 2021 about Kendall Square. And it has a map in it that showed these different nodes of what became Moderna, like a first meeting in Bob Langer's lab, and then Stefan walking over the bridge in a conversation with Newbar, who was here, and then within a square mile, to your point.
And now amplify that times all the companies here.
Exactly, yeah.
It's extremely inspiring.
Two last questions, or one question aimed at two audiences. So part of the goal of the day we're celebrating today is to bring more women into the field and allow them to rise and lead in the field. And I would ask you to address both this audience, any advice you have based on your own experience, but also we're going to post this chat on the internet, share it with schools. Also, just close by addressing the 9-year-old with her first science kit, who has not had the mentorship or the opportunity, but is following her nose and is really thrilled with the idea of scientific discovery. Advice.
So I think one of the most important things to instill is the passion and the excitement about science, about discovery, about the potential for what that is. It's hard to know if you love it without ever having experienced it. One of my main, personal missions, right, is to bring excitement around science and a lifelong love of science to as many people as I possibly can in my lifetime. I think some of the aspects of my own life that I can, relay. Again, I never had training in almost any area in which the next stage, you would argue, was a success. I was never a biochemist entering my PhD, and then it was biochemistry that allowed us to solve and figure out that this was going to be a new path a new pathway by which cancer is driven. I was never an entrepreneur, but we were able to, with the help of others, found Foghorn. And I think that just shows that the expert advice and mentorship is out there. You just need to seek it out. And that's easier said than done, and you have to be in the right positions. But I think sometimes it's the profound naivete, actually, not knowing how something works at all. And it's some of the best ideas that have happened that we've seen, kind of traverse the field here, have come from people who have never seen and never had that experience with really deep molecular biology. Some of the most exciting discoveries, I can speak from personal experience in our lab, have come from people who are totally not wired to think about exactly what we think about. And so I think the more times that we are all able as a community to engage folks that have perhaps not had the same exposure to science and medicine, the better we'll succeed in this whole idea of driving forward a new community.
So before you get to the second piece of advice, that's just so worth pausing on, because there's so many studies of how often women count themselves out from a job application because they don't have this or that. So, if you're thinking about this as Mad Libs, remember Mad Libs? I can't possibly do fill in the blank because I'm not a fill in the blank. The advice here is erase that.
Yep.
You can absolutely do X. Maybe you'll be better at X because you're not Y. So really good advice. So
these days, there's no way to really. I don't think I categorize myself as any one type of scientist. I'm just a scientist because I like to explore biologic problems. But more and more, we need to incorporate the diverse approaches. More and more, if you look at the number of authors on papers, if you look at the number of teams on patents, the number of people on teams on patents from companies, it's increasing. And that's because you need a much more wide repertoire of skill sets to answer challenging biologic questions, and certainly to push forward drug discovery efforts that are meaningful. So there isn't anything you need to be or not be. You gain training, you do what's fit. You recognize the pattern, you go forward with that, and you do what's fit to best enable your current position, your current thinking, your current interests.
It's a great. Do you want to end with an advice to the younger audiences who will see this chat? Or
Sure.
The advice might hold there too.
Yeah, the same advice, but never give up on pursuing the passions. This is easier said than done. The passion and the curiosity, that is the most important skill. When people ask, what do we hire for? I think many people in this audience would agree with me that the one thing that's most key is someone's passion, excitement, and curiosity. Because somebody who has that innate, deep curiosity will never be satisfied with a topical answer. And therefore, that person is always going to be on a hunt for the deepest understanding of something, the most complete understanding of a field, the farthest we can push drug discovery and clinical medicine, and so on and so forth. And so don't stop halfway through answering your questions. Pursue these as longitudinally and as completely and thoroughly as you can.
All right. I could ask you questions all night. I'm sure you could listen to these questions or ask your own questions all night, but we have a fantastic panel to follow. So ask questions at the reception following. Sigal, thank you so much for your insights, for the advice. Wonderful. I'm going to ask my colleague, Justine Levin-Allahan, to come introduce our panel. Justine?
Thank you, Christine, and thank you, Sigal, for such a terrific conversation. It was really such a treat to have you here today, Sigal. I've known you pretty much since you arrived in Boston in 2014, so it's been amazing to watch your meteoric rise, both in academia and biotech. And now I'm delighted to introduce our next panel, which includes women from several flagship companies across both human health and regenerative agriculture. May Orfali is Executive Vice President and Chief Medical Officer of Indigo Therapeutics, with over 25 years of extensive experience in clinical drug development, medical affairs, and regulatory strategy in multiple therapeutic areas, including rare disease and oncology. Hannah Pham is the Science and Platform and Portfolio Manager at Inari Agriculture, where she's helped develop Inari's high-throughput plant cell screening platform and multiplex gene editing toolbox. Lori Rudolph-Owen is Chief Operating Officer at Senda Biosciences, where she brings over 20 years of experience to leading the operations of the company's R&D and platform functions and developing Senda's clinical trials and regulatory capabilities. And Sabrina Yang is a principal at Flagship Pioneering, where she works to conceive, create, and develop new bioplatform companies, including Empress, where she currently serves as Chief Innovation Officer. And this incredible panel of women is being led by Dr. Nancy Simonian, who's a triple threat, a physician trained in neurology, internal medicine, and Mass General, a drug developer who's responsible for the development of a number of drugs, including during her time at Millennium and Biogen, including Avonex and Tysabri for multiple sclerosis, and Entyvio for IBD, and an entrepreneurial leader, including serving as founding CEO and president of Syros Pharmaceuticals. I know I speak for all of us tonight in saying how much I look forward to this conversation. So please join me in welcoming Nancy and our panelists to the stage.
Well, it's such an honor to be here and be able to moderate this panel with this amazing group of women. I just want to say a few words to start out. First is that we have made a tremendous amount of progress over the years in terms of sort of women. Women today are more likely to go into a research career than they were 20 years ago. In medical school, more than half of the applications or the people attending are women. And in the biotech world, men and women enter the biotech companies at an equal representation, which is great. But we have so much more work to do. In research, women are less likely to continue their academic careers than their male counterparts and, in general, publish fewer papers. And in biotech, less than 30% of women are in the senior leadership roles, and less than 15% are at the CEO or the board level. Like, that doesn't make sense. How can we be entering in equal numbers and not ending up in the positions? And it's not because women don't want to have those opportunities. And the other thing is, it's bad for business. Multiple studies have shown that the greater representation that you have of women in companies, the greater the return is for shareholders. So it doesn't make any business sense either. And I think we have a responsibility, if we're trying to do pioneering work and make a difference in this world, that we need to join together and figure out how we can solve the problem of getting more women in the right positions in companies that they deserve to have. And with that, I think this is a great opportunity to share some of the experiences of an incredibly distinguished group of women to learn a little bit more about the various things that they've done and what they've done to try to promote women in our ecosystem. So first, I thought it would be great to hear a little bit about each of their stepping stones, because none of us went to school to become a CEO or a CMO or a COO. There was no manual. That's not what we trained for. So how in the world did each of you get from your training to where you are today? And May, I'm going to start with you down at the end.
So I'm happy to say that there's tremendous progress since the time, the Boone days when I started, to now, because now there is a course to study how to become a CMO at various academic institutions. So it's really great. It took, 40 years or so to get there, but it's there. My journey is, to be honest with you, I was fascinated with biology as a little kid, loved it, loved every bit of it. I knew there's nothing else for me to do but focus on getting to med school. And that was my goal. I'm going to give you a funny story. My daughter loves music. She's a great musician. She came to me the other day and she said, "Oh, maybe I'll be, psychiatrist or something." And I said to her, wait a second. My bedroom posters were human anatomy, were male and female since all I remember, since I was 10. That's all I wanted to study, is really the human science. I said, "Look at your room. What's in there? Bob Dylan, there's Ed Sheeran, go with your passion." So my passion really is medicine, is finding solutions for unmet needs. And I was fortunate enough to come to the US and study at Dana-Farber, MGH, and Children's Hospital. And what I studied there was quite difficult. It was hard for me to see. I was, what I was working on is solid brain tumors in pediatrics. In the 90s, we had no cures, we had no available treatment, and it was extremely sad, and I didn't feel I was doing what I'm supposed to do. I felt my job as a young, naive person to cure people, to help people heal rather than go to funerals. And the head of my lab, and he said to me, it's my first mentor ever, that you got to think of something else. You got to, if that's what you want, maybe biotechnology is your way. It's really, and I said, just show me the way. How do I do it? Who are the right people to talk to? And that took off. And so it's, so that's really my journey. And then, I knew the second sort of big light bulb for me is when I started to realize the role of patients in drug development. It's extremely important. I don't know what were we thinking without it. And when mapping of the human genome occurred, like our panel, our esteemed panelists who mentioned the same, it was, to me, this is our time. This is our time to solve one disease at a time, one genetic disorder at a time, as I was leading clinical group at Pfizer for rare diseases. And it became very, very personal to me, both rare disease and oncology. And I think the rest is history, because this is my focus.
Great, thank you. Lori.
So, Chief Operating Officer, I think there is several different papers written on of what do you even do? So there's many different, I think there's like 7 different varieties or something of Chief Operating Officer. So as a scientist getting my PhD doing cancer biology, how did I end up here? It was following my passion, but it was also being introspective of what do I enjoy and what am I good at? So at Millennium, being a bench scientist, having the opportunity to be on a program that we brought in, I was the research scientist on a development program. And it was like, wow, okay, all of this is going on that I had no idea about. So how do you get the science into people? What's an IND? How do you do all that? So that, to me, it was fascinating. And so as I moved over into really understanding development and be able to pull all that together, kind of sat back and thought of, wow, why is this interesting? Well, then I look back at, when I was in my lab as a PhD, I had like 6 different projects going on at one time. Nothing was really in depth, but it was all going around. When I was a postdoc, same kind of thing. And then my first job in industry, same thing. It was more of organizing, understanding the science, but being able to pick out, wait a minute, this goes to here, and that should come together. So how does that all work? So once I understood that, it was kind of like, oh, this is great. I love it. So being able to pull programs through into development, but there was no training for that. It was all on the job. It was getting into a different program that, cystic fibrosis program that went into phase 1 and then phase 2. What did that mean? I basically just got the experience and understood how to move it forward. So nowadays, again, there is a bit more training for people going on and doing biotechnology and understand what does drug development mean. So that helps. But from my transitions, it was really all on the job, making mistakes, reaching out to people who had done it before, asking how do you do it, what should I look out for, how can I do this better. So it was really based on the mentoring, but the experience of just jumping in and doing it. So it was never I can't do it, I just need to figure it out and work it through.
Great. Sabrina.
Yes. So for me, I think it started off with a desire to kind of translate the idea I have in my PhD project towards the clinic in the form of creating a company. And lucky enough, my PI and my PhD was very supportive of that. And but at the time, felt like there's still so much to be completed, so much to do, and what is a good time to actually go out and start talking to investors and pitch the idea. But around the time, the MIT Entrepreneurial Center was kind of handing out free T-shirts that prints T=0, time is now. And so that kind of really resonates and tells us that nobody really ever feels ready, and just go out and do it. And that was when I started working with my PI and forming pitch deck, forming a team of MDs, MBAs, and myself, and starting going out to pitch and in various courses and competitions. And actually through that kind of opened up my network in unexpected ways to investors, to BD executives that some of them are still friends and have been great assets to have. And what was the stepping stone for me really is to meet someone at Flagship, win one of those competitions, and learn about the opportunity and the very interesting venture creating model that Flagship has. And that kind of led me to the opportunity here. And I did the fellowship program 5 years ago, and it was just an eye-opening experience about how to rethink about scientific innovation and what it takes to translate a scientific idea to the real world in the context of forming venture hypotheses and constantly challenging dogma, and also having that confidence that you can become an expert in a new field that you didn't know about before. So that was what led me to my current role at Flagship and Empress.
Great. Hannah.
Yeah, so I mean, I started my career as a bench scientist, like a lot of people. But even when I started Inari, that was like what I thought I was going to be doing for the rest of my life. And I had a really narrow view of what it meant to be a scientist. But when I started Inari, and it wasn't Inari back then, it was like FL40, and I was employee number 8. You wear a lot of different hats at that stage of a company, and so I was scientist, I was lab manager, I was social coordinator, so I did a lot of different things, and so that really allowed me to try things that were way out of my comfort zone, things that I wouldn't normally be doing as a scientist. And then what really was a turning point for me was being given the opportunity to manage people and to manage teams, which I don't think any of my training had prepared me for, but it was something that I found that I really enjoyed, and then I feel like my progression has since then been really stepwise, and like the scope of my role has broadened, and I started leading projects at Inari to oversee kind of functional teams, and then through that, and I always had this vision that to lead a project and to lead people, you have to be the most knowledgeable person in the room, and I had like a really deep fear of doing that because I didn't feel like I could, but I had really great mentors who pushed me and put me out of my comfort zone to do that. And then I started to realize that actually, like, you don't have to be the most knowledgeable. It's really about how do I put this group of people together and activate this diverse group of expertise and backgrounds and to come together to solve a biological problem and to yield the best results. And that, I feel like, had led me to like where I am now and really diversifying like my reach at the company and seeing how I can bring all these different pieces of the company together in different projects and even through our production pipeline to yield better results. So that's kind of what led me to where I am today.
Great. So I think a couple of the things that I heard from you all speaking is sort of one, kind of doing things that actually you really love or that you have a real interest in. Because your career is a long period of time, you spend a lot of time doing, so that intrinsic interest in an area, I think, sounds like is a common theme. It sounds like the other is kind of understand what is it that you think you're good at or what you like to do. Some people are really good at working on the details of something. Some people actually like to step up and look and figure out how to put pieces together and like figure out who you are. Don't try to do something that that's not who you really are. The good thing is that we're all diverse, so the more we can understand each other and then fit in the right place there. And I think the other thing that I heard was be okay sort of pushing out of your comfort zone and kind of having the courage. And it's not that you have to know everything, but you have to know what does it take to be successful, and it's less on the technical details. It's more like, how do I think about bringing the right group of people together? And I think so some of those other aspects of things I think are kind of what I took away from this, which I think could be helpful to folks. So let's just dive into a couple other questions, and maybe Sabrina, I'll ask you this here, kind of what drew you to a career in science, and are there skills you honed as a scientist that you found responsible now kind of beyond the lab in terms of the work you're doing?
Yeah, sure. Yeah, so I think what drew me to science really is this idea that there's seemingly infinite possibilities of things that one can create once you understand the fundamental principles of how things work. And as a kid, I've been fascinated by math and physics, and part of that was because I loved the challenges and I loved basically the feeling of solving really hard problems. But really what put science into context for me was when my grandfather died of lung cancer, and even though my father at the time was a pulmonary physician and specialized in lung cancer treatment and diagnosis, seeing that there was nothing he could do to help his father, and made me realize that in this case it wasn't about having access to the hospitals or the best care, but it was about there simply is not treatment options for patients. And that really put the science into context for me. It's about using the knowledge one can have to then make an impact in the real world. And that was what kind of led me to my career. And in terms of skills, I think, well, the first is during the PhD training, I think one of the things that really helped a lot was realizing that I can be the one person in the world that knows best about what I was working on and in a specialized subject. And having that experience gives me confidence that I can become an expert in a new field and can do this over and over again. And of course, the others are communication, for example, was an important one where, yes, we all tend to be quite technical in the scientific world, but at the end of the day, not only the science has to work, but people really need to understand why it matters.
Hannah.
Yeah, so even as a young child, I really always loved puzzles, and I really enjoyed like problem solving and things like that. And then what really drew me to science is that as an undergrad and kind of working in a lab environment, it was like doing a puzzle, but you didn't have all the pieces, and you had to rely on a lot of other people to get those pieces. And I really loved that collaborative environment. It was like this insane escape room almost of doing research. And so that's kind of like really what drew me in and maybe want to continue in this career. And I think one of the skills that I've had to learn through science is similar to Sabrina. Just effective communication is so important because you're not always going to be explaining your research to someone who has the same background that you do. And so being able to communicate your needs and also your perspective effectively is super important, but then also makes you a better scientist because you're seeing things through a different lens by forcing yourself to explain it to a different audience. And that, to me, is something that I've really been able to translate beyond science.
Cool. So Lori, what steps can each of us take to be stronger allies for our women colleagues?
Yeah, I think one of the biggest things is just opening doors for our colleagues. There's been many instances that people said, okay, take me through your career. And so I've had coffee with them, et cetera, which is great, kind of part of that mentoring. But I think bigger pieces is who can I introduce you to, right? What do you want to do with your career? And where have you seen the doors close? Whether that's, discussions about, opportunities, connecting with recruiters, with knowing other individuals that have openings. I think really just providing that connectivity for those of us who have, pretty good networks is sharing the network, sharing the connections, sharing the job openings, understanding that, you get a recruiter that calls you for a certain job and you're like, it's not right for me, but I know 2 other women that it actually is really good for. So I think making that connectivity and pulling women up along with you is really important.
May, how about?
Totally agree. Completely agree. We have to figure out a way to think of each other at important time points. And I would go one step. Maybe our colleagues are not asking us for things, but we should keep this repertoire of women that want to do something, that there's a need, and make those connections organically. I think it's really important. The other thing for me that's important is that we need to lean into each other and understand one another. We talk about diversity, but with that comes challenges in terms of backgrounds. What do we mean when we say sometimes the same sentence means different thing to different people? So lean with kindness, truly lean in with kindness and learn where people are coming from and understand how to solve for a problem. Because I feel the human aspect is more complicated than the technical aspect. And if we solve for that, if we build trust, true trust along the way. And I would say the other thing is my advice is to choose opportunities truly your heart and soul are into it, and not only for financial piece. I know finances are important when we first start our job, that we need to pay bills. It's very important. But we have plethora of opportunities these days relative to, again, I'm dating myself, to dinosaurs' time when there was none. It's good to see the opportunities flourish, so make your choices well with something that whether it's an indication you're passionate about family-wise, or it's the group of people, scientists that you trust, that you want to work with. Those will go a long way. And I think we just need to think of each other a lot more. Definitely the number of women on the board need to increase. It's less than 5%, even at this day and age. We have made progress. It was probably less than 0.1% at a point of time, but we have a long way to go. So we certainly should think of one another organically in opportunities.
Yeah, I agree. I think, it's a little bit of if we get more women in the right positions, then they can think about making sure that we bring more women into those positions. And I'll just give you a little anecdote on that. I'm on the chair and nominating committee at a public company, Biotech, and I was the only woman on the board, and we needed to bring some new board members on, and I went out to my network, including people on the board, to get some ideas, and they were 90% men. It's like, we are not doing this. It's like, we are going, and it takes, because sometimes the pool and the network is not as robust, or at least it feels like it's not as robust. There's this, I don't really have any choice. There's not enough women to kind of, and I think that's complete, I'm not going to say the word, but every time I hear that, I can't believe people are still saying that. But it does take this, conviction that we're going to make change. And, and as it relates to this board, we brought on, since I took over, 2 women and 1 African-American man. And it's doable. It's like it just, but it does, but there's an inertia that I don't quite understand, because going back to the business thing that I mentioned is like, it's good for business. So if we can get more people in the right positions, and we just need to make that concerted effort and open the doors and tee up people for positions and networking. Absolutely. Yeah. So Sabrina, what is the best career decision you ever made? Any setbacks along the way, and any advice that you didn't take?
Yeah. So I guess I'll share a story about growing up. So I grew up in Taiwan, and that's where the education system is where one needs to decide if you're going to be taking a STEM track or a non-STEM track at the age of 13. And so, luckily for me, I had always liked math and physics, and so I knew that I wanted to be in engineering, and that wasn't a difficult choice for me. But growing up, I'd always thought that I want to be a semiconductor researcher. I want to, make organic LED for displays. That's kind of what I imagined what I would be doing growing up, and had been pursuing my career in material science and engineering for that reason. But when I came to MIT for graduate school, I started to struggle a little bit about what do I want to do in terms of what lab do I want to join. And someone gave me an advice to sort of think about, well, what do you want to do after your PhD, like after that 5-year? And I knew that I really wanted to translate my scientific knowledge to the real world in the context of creating companies, and I knew that I wanted to be doing something that impacts human health. And so that kind of guided me to deciding to almost transition my career from an engineering materials science track to joining a lab focusing on immunology and applying materials engineering mindset to immunological applications, including cancer immunotherapy and whatnot. And I think that was the best decision I've made in my career, because that led me to where I am now, and I'm doing something that I'm truly passionate about. Waking up every day full of energy to think about new ideas and execute, and building an amazing team to kind of go forward with a mission that we all are on board with.
Lori, how about you?
Actually, the best decision, I think, went back to what May was just saying. I was a scientist in a lab running a couple of programs, had a couple of research associates, and realizing that I wasn't that happy doing that, and I had gotten a little bit of bug of understanding what development was. So I took the leap and moved straight over into program management, taking 3 or 4 steps down and back in my career, and definitely my salary. It's a big discussion with my husband, but he was very supportive. And being able to just be more free with that decision to pursue what I really enjoyed doing and wanted to do. And it didn't take too long to be able to realize, okay, this was a really good decision. I really enjoy it. And being able to do that for a couple of years, and learn a lot about development. But then this kind of goes along to the advice that I did not take. In that same position, I was there for about 2.5, 3 years. Had a great opportunity to work with a program executive, Eric, and who was teaching me about how to be that team lead, right? How to lead these programs. He also gave me an opportunity to be able to kind of do one of the smaller programs on the side. So got a call from a recruiter to say, hey, we got this, team lead position open, and it was back in oncology, which is what my passion was. And the time I was actually 4 months pregnant with my second. And so the company I was at, my boss basically said, that's a really dumb idea. He's like, you can't do that. You need to be in this position for much longer than 2 years. You need to be here for at least 5 or 6 years before you can take that next position, and you're not ready for it. He actually said this. Go and talk to your husband.
Yeah. Wow.
Yeah. And I said, okay. I still would have not taken advice, even if he didn't say that, but that really sealed the deal. So then, basically looking at it and saying, wait a minute, I can do this. Yes, I haven't done the team lead position yet, but, I think I can do this. And so taking that leap and not taking his advice definitely was the best thing that I had done.
You made me think a little bit about, I think probably in each of our organizations, and I'm thinking about one in particular at my organization, there was a really talented young woman who was in a particular technical role, and I could tell that she had a lot of opportunity to think much broader, kind of in the program management side. And so just, sometimes kind of keeping your eye out and just sort of saying, I think this person kind of has the right thing for something different that they may not have thought, and then encouraging them to think about that. And I think that's, again, another way that we can, use to kind of open doors, but because having a sense for somebody's kind of innate opportunity or ability in an area that they're not necessarily in. I think we can all do that more, especially when we're moving from a scientist to another role, or a physician to another role. Great, so let me just finish the last question for each of you. What would you say to future women scientists seeking inspiration and guidance? And Hannah, I'll start with you.
Yeah, I think one of the best pieces of advice I've gotten is that you should, I think a lot of people probably might have heard this, but just get comfortable being uncomfortable, and just don't be afraid to stretch yourself and go for positions that you may not think that you're qualified for, because you probably are. And it's okay to try, but it's really important to find really, really great mentors who can help you and support you and challenge you, and also give you that safe space to be able to fail. And that has been hugely important in my career. Be okay with failing. It's okay, and make sure that you have a supportive network where you can do that. Because science isn't something you should be doing alone, and it's really great. Things like this, right? We can build a network and really help and support each other, because we shouldn't be going at it alone, and we should be using our network to boost ourselves and each other.
Sabrina.
Yeah, I think what Segal said earlier really resonates with me about following your passion. And I think just remember that a lot of the most important discoveries actually initially will look like a huge setback, but don't give up, and continue to pursue your dreams and goals. And the other I would say is for the women who are interested in kind of going into leadership roles, to not be afraid to develop your own leadership style with authenticity, and not feel like you have to follow a male style leadership in order to be in that position.
Everything that they said. And also, don't be afraid to meander your career. So sometimes there's a direct path, many times there's not, and that's okay. So being able to kind of meander, figure out what you enjoy, it might change too as your life changes, as your responsibilities change. You might want something different, and that's just fine. And don't have anyone be able to say, no, you should be doing this. Figure out what you want and go for it.
Passion is key. You have to have passion. What you're doing is what wakes you up in the morning and what drives you. I think it's important to know that it's okay to make mistakes. Every single day we make mistakes, and it's totally fine. we're going to grow from it. I'm a big fan of having a journal to write in it of what did I learn today. I try not to skip a day. I think those are helpful for me to learn what did I make a mistake in, but without beating myself down. It's a journey, and we're all on this journey. And be bold, and don't let someone tell you, ask your husband.
Excellent. Well, thank you all. Let's commit that in 10 years from now, we're not talking about the stats that I told you earlier. We've got to do better, and I'm really excited. I just want to thank Flagship for doing something like this. I think we have the opportunity collectively together to make a big impact in our industry, and really all starts with us. So just go for it. So thank you.
Thank you, May, Lori, Sabrina, Hannah, and Nancy for the conversation. It's just so wonderful to hear from all of you tonight, to hear your individual stories, your collective stories about what drew you to a career in biotech and science, what kept you in this field, and the types of support and career development efforts that made a difference to each of you as women in science. So what really resonated with me is, I personally have been in situations over the course of my career. People saw things in me before I saw them myself, and I'm just so grateful for those folks, for that mentorship, for that guidance, and for seeing those things. So as we conclude the evening, it's really my pleasure to invite Flagship founder and CEO Noubar Afeyan to share a few remarks. As many of you know, that one of Noubar's core beliefs is when it comes to pioneering, you have to trust your crazy ideas. And our North Star at Flagship is cultivating the environment that allows full teams of people to express, interrogate, and ultimately trust all of our crazy ideas. And to do that, it means that we have to ensure that everyone has a voice and a sense of belonging. And so much of what Noubar has done is to create communities of belonging, and in particular within the Flagship ecosystem. And all of us here tonight represent yet another one of these communities, and we're just all so proud to be a part of. So please join me in welcoming Noubar to the stage.
Well, hello everyone. This is an intimidating both setting and crowd to be in front of, and yet very exciting. I was in the back for about 10 minutes into this, I think, and it was great to see the discussion and the texture of it and the nuance of it. There was a lot of things that people said in a particular way that I think reflects the difference in our environment, maybe compared to other ones. And that's what I would celebrate. I would celebrate the fact that many of the people who spoke, and all of you here, are pioneering in your own ways, double pioneering. Pioneering in what you're doing in your careers, in your lives, but also pioneering with science. Some of us who are not in the group we're celebrating today don't have to pioneer twice. We pioneer once. And I have that experience in my life because when I started out 37 years ago, I was a 24-year-old immigrant. And I've said this to others, that basically a 24-year-old immigrant in 1987 felt about as fish out of water as some of you may have felt many years ago. And I'm actually quite optimistic, quite confident, and quite encouraged by the fact that these things seem like they don't change for a long time until they change, and they change very, very rapidly, because normal becomes redefined, and people start wondering, why weren't we doing this all along? So you heard about diversity of thought, of experience, huge part of innovating, even a bigger part of pioneering. And one of the things I'll just kind of share that makes me optimistic about kind of the opportunities ahead is that, when you are fighting over a kind of a well-occupied space, you have to look at all your disadvantages and all your kind of competitive, but if you're going into something that nobody else is doing and you're all on your own, well then you can write the rules. You can fix the biases. you can do all the things because you get to make up what reality looks like. And I think that as I sat there looking at the backdrop that Christine and her team had kind of come up with for the JP Morgan, this notion of making bigger leaps. When you make bigger leaps, you have actually a lot more room to operate, a lot more flexibility. And I hope that gives you even more of a sense of short-term opportunity to change things significantly. So I want to thank you for allowing us together to celebrate kind of the women in science, but importantly pioneering in science and that aspect of things, but also kind of really help us bring about the changes that you're talking about. You know, this is all about creating opportunities, giving opportunities, and taking opportunities. Everybody has to do their part. And so I think that we can do that. And I, again, want to thank you for giving me a chance to say a few words. Hopefully not entirely disappointing, but I figured in the back, I said, what am I going to say now? Usually I'm not stuck in that, but thanks. That's all I can say. Thanks for doing what you're doing. Thank you.